Okay.
So welcome everyone to the Texas Children in Nature Network webinar, Mental and Physical Benefits of Being Outside with Ken Baum. My name is Sarah Coles and I am the Executive Director of the Texas Children in Nature Network, and we are excited to have you with us today. We're recording our session today. Thank you again for joining us. To save bandwidth for our attendees and for a clean recording, we ask everyone to turn off their cameras and mute themselves during the presentation. Our tech helper, Kevin, today will be monitoring the chat and can help share our questions. Kevin is running tech for us today. Thank you so much, Kevin. We are recording the session and Alice will share the recording in a follow-up email in a few days. If you're uncomfortable with your name showing, you can change your name to anonymous and then private message Kevin with your name for our attendance. Also, if your Zoom name doesn't match the name you registered with and you are needing a CPE certificate, please message Kevin with your name so we can make sure you're on our attendance. If you are needing a certificate and we don't have your name, we will not be able to provide a certificate. And that means things like iPhone or your phone number. And so definitely make sure that we know your name so we can get you a certificate. And just a reminder, if you're needing a certificate, you will need to follow the directions that were in the email that you got with this Zoom link. I'm going to go ahead and do our land acknowledgement. Texas Children in Nature Network is headquartered in Austin, and as such, I'm on the ancestral and unceded land of the Tonkawa, Comanche, and Sana people. Our ongoing colonial presence on Indigenous lands compels us to take action now to counteract the effects of colonization. The work we do through the Texas Children in Nature Network is one small step towards that effort. And in just a minute, I'm going to put a couple of links about land acknowledgements in the chat. I'd like to go ahead and welcome our speaker today. Ken Baum is with the Department of State Health Services. Thank you so much for presenting today, Ken. And if you give me just a second, I'll get your presentation pulled up.
Absolutely. Thank you, everybody, for joining me today. And I look forward to sharing a lot of information about Texas DSHS as well as the newest program that we've initiated within our region. My name is Ken Baum, and I work for the State of Texas Department of State Health Services. I've been privileged to work here for the last 2 years. I was surprised as I began this newest journey of my professional career to learn about all of the services that DSHS provides. I wanted to share some of them with you, in addition to the mental health and nature awareness program that we rolled out. Well, actually, we just started this about a year ago today, and when it was really starting to be formed. If I go to that slide, we will, of course, dive into that awareness campaign. We'll give you a lot of details about it and how to get your hands on it, in addition to what our region has done to provide support within our community, which I do want to talk about the people that I work with. I'm very privileged to have had this developed with Amanda Watson and Carla McKenzie are two of the most key people on the planet that helped drive this awareness program. But in addition to that, there's an awful lot of other people that have been working within our region that they're just spectacular in many different ways. Just as a quick example, one of the nurses that works with DSHS makes herself, no, go back. You're kind of going, there you go. I'll let you know. Anyway, one of the nurses that works with our organization makes herself available to pregnancy centers or school counselors. And sometimes there are young children, well, I say children, but 12, 13 years old, they get pregnant. They don't understand how that happened. And she educates them on a one-on-one basis in a very caring way. That's the kind of dedication and ability that these people have that I work with. And I'm very proud to be part of this organization. The next slide, please, is regarding, I specifically work for Region 4-5 North, or what we call as the Piney Woods. All regions and services are not exactly alike from region to region, but I promise you, if you were to give your local DSHS office a call, they will probably strive to work with you and with whatever you might need. This being the first area that I'd like to talk about is under the heading of maternal, infant, and child. We provide education to a variety of organizations, from pregnancy centers to educational support for schools. We also do a number of things to physically support expectant mothers and provide educational services such as Shake and Baby. And we provide pack and plays for indigent parents that may not have the ability to have a separate sleep area for their child. You may have heard most recently in Titus County, there was a very unfortunate situation involving an infant and a sibling sleeping on the same bed. The sibling, 18 months old, rolled over on top of the infant, and unfortunately the baby passed away. We provide that kind of education. We provide that kind of knowledge to parents that sometimes don't look at those hidden dangers involved with how infants can be injured. And a lot of parents even want to sleep with their infant in the beginning, and the dangers are just too great. So that's why we provide pack and plays. Car seat safety is another way that we absolutely provide. You kind of look at that and you think to yourself, okay, car seat safety. A lot of parents don't understand the need for car seats. And as a car seat technician myself, I have a lot of parents that just drive with their baby in their arms. The state of Texas works with Safe Riders and to provide parents who can't afford, and those of you that have had to pay for car seats know how expensive it is to buy them. Well, we'll provide them to them. We'll also inspect them and make sure that they're installed properly, make sure there's no recalls on them. So to give you just a fast idea what it's like to become a car seat safety technician, it's a 40-hour course. And you learn it on a national level, not just the state of Texas level. The course is incredible. I'll be honest with you, as a dad of 6, I would look at a picture, that's the way it looks, and that's the way I would put the child in the car. But knowing now so much better, there's so much more to go to it, such as manufacturer guidelines as well as vehicle manufacturer guidelines. It's one of the more, I guess, fulfilling parts of my job is being able to do that, which, by the way, I'll be doing it again on Saturday in the city of Avenger. But anyway, that's, again, one of the things that the DSHS does is they supported me in going to get the education so I can support this service. Next slide, please. Teen drivers. Now, I've gone to schools and had conversations about what it's like to warn the dangers of texting and driving, and encouraging teens to drive safely. Those of you who have worked with teens in the past, have teens of your own, have been a teen, know that it's very difficult to keep their attention. And but the way that we approached it this time, and it worked very well, was to talk about the other drivers as opposed to the way that they drive themselves specifically. However, it went across very well, and they were engaging, and it was a lot of fun to do that program. But now we're the next step within DSHS in our region. We're working on an awareness program around prom and spring break, and of course graduation, all being a potential for teen drivers with less experience and to conduct themselves in a safe manner. Next slide, please. Yeah, mental health and substance abuse is another way that we work with a bunch of other organizations. Everybody knows, I'm just going to mention the opioid problem that we have in our nation, and the way that we work with schools and we work with organizations to help them understand that they can get their hands on a substance called Narcan, which is kind of the anti-venom to an opioid overdose. If you need more information on Narcan, or we'd like to educate it, if you need more information about that, get a hold of me and I'll send it to you. But in addition to substance abuse, I went to a school where they put all of the elementary school students into one gym for me. I'll say to you, it was spectacular to see these 1st through 5th graders all in one gym. It was loud, it was incredible, and it was a lot of fun. We got to talk about cyberbullying and bullying, and afterwards I asked for feedback from the teachers about the presentation, and they said that they loved it, and as much as that they know that it's had an effect when when the students started reporting to them that they feel like they're being bullied. It was really an incredible experience for me, but I'm not the only one that does it. I'm positive there's other DSHS people out there that are doing equally as good work. Next slide, please. Injury prevention can be a number of things. We work with tech stop, for example, on bicycle and ATV safety, and doing these presentations, making them fun. We talk about water safety, and I want to take just a moment to talk to you about that. I was impressed to find out how many of our DSHS people are involved with going to local lakes and public swimming pools and providing life jackets just on a loaner station. So there's a sign and there's a bunch of life jackets in a variety of sizes that says, hey, if you're going to swim and you don't know how, or you want to get into the water, they can borrow one of these life jackets in order to stay afloat and have fun in the water. We do the same thing for boating areas as well, that worked with the Texas Department of Wildlife that provided them with some life jackets. So rather than just issuing a ticket because they didn't have enough life jackets, they have the flexibility of giving them loaners to be out on the water and be safe. A lot of people don't know that that in Texas, in order to graduate as a high school senior, you're supposed to have a CPR and basic first aid training. Now, the rules around CPR and basic first aid training are that you're only allowed one instructor for 6 students. So DSHS supports our schools by going out and supporting our instructors that can go and get more than 6 students at a time. We can get 30, 40 at a time, and then roll them in and out so they get certified and graduate under Texas law. This again is one of those things that DSHS supported for me and making me a CPR instructor, allowing me to not only they paid the fees, but they also allowed me the time to go do that. Next slide, please. Health promotion. This is one of those that we work to educate nursing homes, hospitals, pregnancy centers, wherever we go, on a variety of topics. We work with, obviously you can get information from the CDC, but we can also talk to people on a one-on-one, on a presentation basis to inform and educate how to live a stronger, healthier life with conditions that they have to face on a day in and day out basis. We also promote sexual health, with providing condoms and things like that in order to support that cleaner lifestyle living and that environment. So it is one of those that people are open to in the right setting, of course. Let's go to the next slide. This next one, coaching boys into men, in order to become an advocate, it takes us 24 hours of education, but I want to make sure that I explain this one properly. Coaching boys into men is a evidence-based program that recognizes that student athletes are leaders, and they during their athletic connection, their leadership and influence is impactful in their own organization. Now, apart from parental guidance, which as a parent, as parents, we understand that we do have an influence, but they get to a certain age and kids tend to listen to their friends or their coach or even their pastor. But and that's in no particular order. But bottom line here, though, is we realize that peer pressure is one of the most effective ways of getting students to act in a proper way. So what Coaching Boys into Men does is it provides coaches with this evidence-based program. So it's the curriculum already written to talk about subjects like respect, integrity, nonviolence, mental health, and insulting language. That's just a few of the topics. And those of you that live in Texas know how difficult it is to get a coach, especially a football coach, during the season to get this started. So the idea now for us has been to move more towards the middle school and having those athletes given some guidance. 37% of Texas athletes are in single parent homes, and sometimes they don't have all of those types of conversations that with their parent. But this is a it's been around for about 5 years, maybe a bit longer, and it has a topic by topic way of having and communicating these important topics to young men. Those of you might be asking, well, do they have one for coaching girls? And the organization Futures Without Violence is working on that topic. I haven't seen it roll out yet, but I'm expecting it to come up relatively shortly. Next slide, please. So in addition to all of that and all of the things that we do to support the community, our main functions might be a little bit different. For example, in my world right now, I support a tremendous nurse who works with tuberculosis and to test and treat tuberculosis patients. My role is to provide her as much as the support as I can give her. She's the one that does all the clinical work. But after a patient is diagnosed with active tuberculosis, the state mandates that we go to their home on a daily basis and provide medication, watch them take it, and then record it accordingly. We test them on a monthly basis to see how their body's reacting to it, et cetera. But that's just one of the things that we do. And then, of course, there are those that work with immunizations, which is, frankly, one of the more challenging, because especially around back to school time, and everybody wants to get immunizations, but they help people who may not have health insurance. They help people that are indigent and they need to get immunized and be healthy. The zoonosis. Zoonosis is, that team is so special. They keep an eye on infectious diseases that is transmitted between species of animals and then to humans. I mean, you might think of like rabies as being one of those things. They look for patterns. They look for threats on the way of because with the kind of warm weather we're having right now, we're probably going to see a lot more mosquitoes. So with that, they're going to be watching for kind of patterns in order to help the public stay healthy. This is, again, it's some of the most incredible group of people that you've ever want to work with. And just as maybe a selfless plug, if you ever had a desire to do any kind of work like this, go to Texas Workforce Commission and look into DSHS. Next slide, please. And now we're going to go to mental health and nature. The need that was identified, or how this all started, was Dr. Sharon Huff. One day, while she's on a trail, kind of taking the jog herself, she was noticing that, hey, this would be a great opportunity to encourage people to tie in not just the physical well-being of being on that trail, but connecting it to nature. So she discussed it with the team and said, guys, I think we can come up with a good program that encourages people and educates people on the physical as well as the mental benefit. Next slide, please. So we jumped in and said, okay, well, let's see how big this opportunity is. And this is just the state of Texas, just taken right off of Google, that says here's how many parks and sites there are that are open to the public. We said, all right, well, that's good information. The next slide, please. And so we decided to drill down a little bit more and look at the communities. And this is just a snapshot of Houston. Again, the same kind of information being taken right off of Google. The amount of parks and green spaces, hike and bike trails that were available. That's rather large cities. Then we went to Tyler and took to see how many they have there as well. And this doesn't even include what might be private parks. But this is just a quick demonstration of how many parks that are out there and how well we can maybe make an impact here. Next slide, please. So then, not wanting to reinvent the wheel, I contacted our Austin research librarian and DSHS, Ann Tarpey, and sent me a ton of information about the benefits of hiking, biking, jogging, and running. this information was kind of overwhelming. I thought maybe I could print it out. No, I didn't want to do that and waste all those trees. Bottom line here is that it became abundantly clear how when people exercise regularly, they have a better mental health and emotional well-being and a lower rate of a mental illness. So there's definitely something here. We also asked her to see if there was anything anybody else anywhere in the U.S. has developed such an awareness program. So not wanting to reinvent the wheel, I thought, okay, what else are other people doing? And her results were the same as mine. I even a simple Google search couldn't find an awareness program where it ties in mental health and nature. Next slide, please. So what would a poster look like? Our team came up with a couple of these, and this is what it looks like. The tongue-in-cheek take a hike, and then putting in some information for really it is we thought was pretty artsy and pretty cool looking, but then we realized too that we could run into copyright issues, and these pictures weren't the ones that I've taken. I did go out and I took quite a few in order to avoid any copyright issues, but we really needed some help. In addition to that, we used on these early posters a QR code. Now, I know, if you would, next slide, please. I know most of you are probably very familiar with what a QR code does, but what it did for us is it really helped test the waters. We got a QR code that we could track with the quantity of hits. So when we put up a test poster, it was, I want to say 3 posters, one small town park, and with the QR code was just some of the stuff we wanted to measure how well people were responding to it. We were able to achieve 80 hits in about 60 days, and it was simply, these posters were simply in English as well. They weren't even the fully developed program. So our next step was to, next slide, please, go to DSHS communications. These people are understaffed, overworked, and awfully nice to work with. Once we got the conference call together and sent them a draft of what we were working with, they were, we explained to them, hey, look, we really want it to be something like if you're riding a bike, or if you are driving, or if you're just jogging, that's something that you could look at, identify the message, and then look into it for more information if you choose to do that. They responded with such tremendous support, and so much so that they were the collaborative effort has developed over now. This is a DSHS program where they rolled it out to everybody to make them aware of what they were doing. If you would, next slide, please. So this is the very first poster that was developed, and you can notice English and Spanish, both landscape and in portrait. These are easily printable, so that what we did is we used a weather-resistant yard sign on the landscape version. We put the English on one side, the Spanish on the other, and then started distributing them. The posters themselves are very easy to read. They come with the QR code. Next slide, please. And we're just going to kind of take a look at what was developed. We were wanting to develop more, but limited to time and evaluation, we got 5. Next slide, please. And you can see how interactive, easy to read, easy to understand. Next slide, please. And there's my take a hike again. Again, a little tongue in cheek, but I enjoyed it. Next slide. The focus on this is not to put it just on a trail, but in playgrounds or courts in order for them to be fully used. I'm going to go to the next slide. So you can see it has a variety of uses within any park, trail, and easy to install, but the key component is where were we going to install it? I'm very proud to say that the very first attempt of, okay, where are we going to find these places and having to get permission to put them out, I announced on a webinar with Texas Children in Nature in our region, the Piney Woods region. It was just one presentation, casually showing what the posters look like and the willingness to distribute them. Texas Children in Nature Network in the Piney Woods region, the people that were on that call had a tremendous response to us. We were thrilled to hear from many towns that weren't even in our region, many areas that were within our region. The overwhelming response was just so incredible to us that we quickly were running out of the posters. Region 45 North was the one that spent the money on producing these posters and then distributing them. However, we couldn't do that outside of our own area. But what we did do is we sent the information to the regions, the DSHS regions that had cities and areas that were requesting it, so they were aware of the program. And as we will do for anybody today, we'll just send it to you if you want to print it on your own. Next slide, please. Nope, one back. Just when you thought it was safe. All right, so we will help anybody, and I am your main contact. So that's me, Kenneth Baum, Kenneth.Baum at dshs.texas.gov. And we will provide you with the PDF file so that you can print them on your own. We will support you with information regarding any of the things that we do to support the community. But just when you thought we were kind of rounding out the end of this, let's go to the next slide. But then I'm going to show you the next generation of slides. Go to the next slide. These just came out, both in English and in Spanish. They are in production as we speak right now. So we'll not only have 5 of these posters, but we'll have 10. And we're giving that flexibility. I mean, our communications team is one of the people that helped develop these. They weren't thrilled about having to do it again, but when they found the response, they were thrilled to do it again. And we are so happy to have these. So next slide, please. You'll notice they're in English and in Spanish. They will be in portrait as well as in landscape. Next slide. Sorry about the cut and paste, but I wanted to show them in this presentation. That's why I kept them to the very end. Go to the next slide. And I think they're going to do exceptionally well. Of course, they're not, my cut and paste is not the best on this job. I'm sorry, because I can see that some of the verbiage got lost. They're going to look just great. Next slide. I just think it's wonderful that they can go essentially anywhere. Next slide. They can go in doctor's offices. They can go in clubhouses. They can go, next slide. They don't have to be in the weatherproof paper. It can be, it can just be printed out and then distributed that way. Next slide. And of course, I think there's one more. And next slide. I think that's all of them. We can verify mine. Yeah, and there you go. And again, that is my contact information. Shouldn't have used blue. Anyway, I'm going to say to you, I am thrilled to be part of this organization. I am thrilled to help you with obtaining anything that you think that you might require from DSHS, or finding your local office, and be able to do whatever I can to support you in those spots and endeavors. As these newer posters become available, if you think that you have a place that you'd like to distribute them within the Piney Woods region, I will be happy to send them to you. The only thing that we ask in return is that you take a picture of what they look like when they're out in the wild, if you will, because we use them as support for future funding. If, as you can imagine, we would need that. We are so happy to be associated with Texas Children and Nature Network. They were the ones that absolutely helped support this program. I'm going to stop rambling and answer questions. So if anybody has anything, I'd be happy to respond.
Thanks, Ken. Lots of questions in the chat about how to get the digital versions of the posters.
Just email me, kenneth.baum@dshs.texas.gov. Just email me.
Okay. And then another question from Iberty, and I'm sorry if I'm pronouncing your name incorrectly. Would it be possible to collaborate with DSHS to table at a trail event?
At a trail event? Yeah, it depends on where it is. And I'm only saying that because we're in the Piney Woods region. We support the state of Texas. If it can't be me, or if it can't be somebody in the Piney Woods region because of the location, we'll reach out to that office and see if they can do something to assist.
And Iberty, I see you have your hand up. So if you want to go ahead and take yourself off mute, happy for you to share.
Oh, hi, my name is Iberty, and I work for the Boston Earth Trail. There's I guess Rails to Trail. One of the advocates for trails is having a Celebrate the Trails event on April 27th, and the Boston Earth Trail is participating. And I just think it'd be a really good opportunity. It's in the El Paso region, so in the border. But I know you guys have an office, so just to give you a little bit of background, do I email you?
Yes, please, Bertie, please do that. I have been to El Paso many, many times, and I'm pretty sure they're not going to let me rent a car or fly out there. However, we do know people, so do what we can to support you.
Okay, thank you so much.
Thank you. And then, yeah, a few questions again, just how to get the signs. Someone says, can't wait to see them. I love the design. Here we go. Can reps from DSHS come to the Environment and Health Expo and do and also clean up? But I think Kim, just go ahead and email Ken and he can get you situated with the right person.
Thank you.
Yeah, and I'd love to be the one to do it if it's within our area, sure.
I would be delighted. That would be awesome. Please bring the posters. Not that we don't want to see you as well, but please bring them.
What the heck? Of course, I understand. I understand exactly. We would. The second generation of posters are in production, and I don't know how many we're going to get, but I promise you that I'll bring what I've got.
You're awesome.
And
thank you.
With this in mind, if one of our partners, say, wanted to partner with DSHS on something, maybe they had an idea of something similar, how would be the best way to maybe partner with DSHS if they had an idea of something similar to this?
Well, sincerely, I know it feels like that I'm really saying that contact me regarding the information and the topic. I work with some tremendous people that if I don't know the answer, they probably do. And it doesn't take much for me to reach out to them. It might take me more than a day to get back to you, but I am happy to do what I can to support you and your efforts and your communities.
We have a question from Courtney, and Courtney, I'll see if I can find that slide and put it up to you. But the question was, there was a slide earlier about significant change. Was this about using the QR code once they were put out? I'm wondering what the context of that change, and how can you also talk a little bit more about how you've evaluated the program?
Sure.
Just if I can put that slide up.
And it was just the QR code part. And QR codes is nothing new to a lot of people. However, using them in this kind of context in order to get to send the people to a resource. So in this case, in the newest generation, it's going to the National Institute of Health, and it's going to be in the corresponding language. So if you use the QR code in the Spanish, it goes to the QR code, or it goes to NIH Spanish. If you use it in English, it obviously goes in English. And what we did early on to kind of test and measure the early versions of the posters, and when we put them out, was we had the ability to track how many times somebody was accessing that information by using the QR code. I want to say it was about 80 times in 60 days, which anybody in advertising tells you that that kind of response is pretty darn good, because that means that they had to take an action. They had to go up there with their phone in order to access more information, which is incredible. Well, I thought it was pretty good. A lot of people agreed, and that's what helped spur on use of the QR code on these posters. And that was a critical change, I think, not necessarily for a lot of people, but for us it was. And that's why we did that QR code. In today's world, because I'm thinking that there's money associated with being able to track them, because they go to an outside website, NIH, National Institute of Health, they're not tracking it any longer. It's just, hey, if you want more information, here's a good resource and way to get it. So that's why, for us, it was a way to prove up the program during the test process, and a way to demonstrate this thing works, and we should continue to explore it.
Thanks. Since you're not able to track those number of scans anymore because they're going to the NIH website, how are y'all kind of discussing ways to evaluate how like these new posters are doing? What kind of things are y'all looking for that?
I'm going to say this to you, that the way that, I mean, we have about 30 some odd people on a Zoom call, and we're getting some really nice response from around Texas and elsewhere. So we're really hopeful that based on that kind of response and that groundswell of need for information, that keeping track of that the way that I do is enough to continue the funding that needed to continue either creating newer signs or just manufacturing more of them. So essentially, we're able to use stories like this one to justify what it is we're doing and how we're spending the money.
Great. I don't see any other questions in the chat. Any other questions out there?
I realize it's pretty straightforward, but the truth of the matter is, if there's anything we can do to support you, I can be your contact person, and you may be hearing from somebody else who'll take the ball and run with it, but I will respond to you.
We do have a question about kind of tech requirements. Is there anything we need to know if we request PDFs of the posters? Any restrictions on reproduction or anything like that?
No, they're wholly owned by, or when you think about it, it's a state of Texas program issued to the citizens, so they'll know there's no cost associated to you about them. As far as the print world is concerned, that's why we went to communications. They said that we could blow it up or shrink it down as much as we want. You should stay a pretty clear print version when you do it.
Great. While everyone, I'm going to see if we get any other questions coming in. In the meantime, in just a second, I'm going to put our evaluation link in the chat.
Maybe more.
I thought we had a Watson, do you have a question
Yeah.
for us? Okay, go ahead.
I just have a comment. I've worked with Ken on this project. Going back to the last question, could I add to that the restrictions? Please don't modify the design in the poster that is out. So that would be the restriction part of it, is that you just don't modify it. You leave it in its original form.
Good point.
We have a comment from Sandra Johnson. Says, thanks so much. I didn't know this program existed. It's a big job. Wishing you lots of success. I did put our evaluation link in the chat. Ken, you already have at least one email waiting for you. And then our next webinar is on March 6th. And it is called More Green Time, Less Screen Time. And every time I type that in, I feel like it's somewhat ironic that we're hosting a webinar on less screen time, but that's the world we live in today. But hope to see y'all there. And before we close out, just wanted to give one last call out for questions.
Sarah, thank you and Alice very much for the venue. I really appreciate the opportunity.
Okay, thank you so much, everyone. You should probably be getting the recording early next week. And thank you so much, everyone, and have a fantastic rest of your day. It's a little cooler than it was yesterday, but it's still a gorgeous day here in Texas. So go on out and enjoy the weather.
Bye, everybody.
Thank you.